So good afternoon. Today we are seeing about GA 11 and 12. So first we are seeing for the application of heat and cold. So what are the purpose we are going to application will give for hot and cold bath. Any rising the temperature, that time we can give the cold compress. Then if you have any swelling, anything means heat or warm cloths and all, we can give this applications. So heat application mainly some we can give the moist heat only we can giving. We are not going to give the strong heat. So what are the condition we are giving? So promote healing or comfort, reduce the swelling or blood vessels. So some heat therapy, then promote for healing, so relieve the time and the relaxation time we are giving that heat applications. So in the heat application we have the dry heat, moist heat. So in the dry heat means we have hot water bag we are placing and giving. So moist heat means six bath and warm water we can giving the bath, that is and all is the moist heat. Then hot water application. So what are the hot water application? We have hot water but in electric bag hot water both we have. Then moist heat we can give some um, external we can giving, otherwise internal we can give steam, moist heat, then six bath. So that is another good effect for the all the conditions. So that's why we are giving the moist heat conditions. Then we have that six bath procedure. For any warm water we can give some betadine or dettol, anything we can giving, but it should not be irritate your skins. If your skin will be irritated means it will be wound will happen. So you can give moist and mild warm water. Then we can go for the cold application. So mainly cold application for any eye fever and all we can giving. Otherwise any blood clots and all we are giving, or any swelling or small injuries and all we can giving that cold application. Cold application we have the dry cold and moist cold. So first we have the cold compress. Cold compress means mainly we are receiving the reduce the temperature, pain, inflammation, and any control the bleeding injury site means we can giving that cold compresses. So if you want, you can soak that some cloth and we can take a cloth, soak it in the cold water. We are giving that cold compression to the particular area. Then we can have gel based packs. So gel based paste what nowadays everywhere we are using. So keeping always that gel paste into the freezer. Then we can take it. Then we can keep further 15 to 20 minutes to repeat for the 2 hours keep. Then your swelling will be reduced. Then cold sponge or a tepid sponge. So cold sponge means if a high fever we are giving the tepid sponge. We can keep for axilla, groin region and all. We can give the ice pads. Then it temperature will be reduced. Then ice cap and collar back. So ice cap, collar back and all we can give for the head. So mainly have any neck injury or any headache, so that time and all we can use this one. So what are the guidelines we can use? So first with the doctor prescription will be there. We should always consider the site, how many duration we can use. Then frequency, everything they will update. Then we can some temperature is hospital policy also will be there. Then never leave the patient to alone while giving. So if you're doing any procedure, patient documentation and all, it's important. Then we can go for that cleaning and replacing of the suction bottle and tubing. Nowadays wall fixed and the portable both is a portable means we can carry off one place to another place in the easily. So we can use the portable. Then suction method wall means it will be fixed into the your walls. So we can use it for a patient bedside in the near most of ICU time it will be work. So we can standard 4 to 6 hours we can maintain. We can always keep for the sterilization method we should use. Then we have because if you're collecting of suction blades or any sputum underments, it will be get infection easily. So we should always keep for gem freeze. Then oxygen and mobilization. So oxygen, everyone knows oxygenation and mobilization means it will be have portable O2 cylinder we have. Then wall based O2 cylinder have. Then we can have the bedside holder have. So usually we can oxygen having we have to the room air or a breathe out O2 mask. So like this. Like this we have, so depending disease condition we can using for the respiratory relaxation of the oxygen therapy. So keep the smoking free area and keep for the oxygen cylinders always upright positions. And then empty the cylinder should be marked for empty, because in emergency time if we are carrying the O2 cylinder, sometimes empty we can carry it, it will fail to that area. So that's why always you, whenever you enter the shift, you should always check that O2 pressures. Then mobilization of the oxygen therapy, mainly we can use it for the hospital side in the stretcher. Otherwise we can portable bed carrier, we can give this along with the patients. If you are doing any procedures or shifting the one place to another place to the wards, you can use this mobilization cylinder. Then cleaning and replacing of urine bag. So urinary catheter and catheter care always you can use for the sterilization method. So the bladder should be always keep the drain. Then the urine bag always to replace in as soon as protocol you should follow that urinary bag to change every 7 days once. Once 3/4 it's filled for the urine bag, you should empty and keep the below abdomen of the below abdomen you should keep the urine bag. Mm, then we have the enema suppository administration and patient cleaning. So always we have that the care of the patient, maybe constipation, if you have fecal infections. So any we that time mandal we should give the suppository or enema. We can give that in administration of the bedside. So we can use the all the equipments and techniques and all we should give. And enema most of liquid can use it. So then only it will be help to waste to come out to the digestive system. Then we have the administration of enema. Mainly we have patient have maybe injection or fluid, anything we are taking means you should relate to the rectum pathway. It will be released to your fecus. Then supposed is the one kind method. If you have high temperature of babies and all, then if your adults getting more constipation, we can using that supposed is always it's a shape and size depend. We can narrow it, we can insert to the one finger method, we can insert and we can it will be observed, then it will be stimulate to that your anus. Then preparing of the patient operation theater. So what are the things we should always prepare for the operation? First check the order for surgery, then we can perform the procedure, then take that consent to the family members, then consult to the surgery site, then we can have the provide psychological support, then we can inform to the post-operative process and everything, then follow the infection control practice, then billing clearance, then we can go NPO for the nil per oral mouth for the patients, then we can IV fluid administration, then if you have bowel rectum edema we can give, then you can have that any surgery preparation should be advised, then we can give the proper bath protocols, then if you have any allergy we should note it and we can mention that sheet, then if you have any jewels and all we can remove it, ensure the pre-medication orders and all, then if you have either loose teeth or eyes lens anything is tearing, that is should be disconnect, then we should always denture anything means that is also you should remove it, then ensure the patient before shifting the surgery concern, then part of the preparation, then physician clearance and pre-anesthesia clearance, then surgical site marking, then investigations, then special instruction, then confirm the OT timings, then book the ICU and verify of the pre-operative checklist. Then if you have any special needs also we can pray. Then we can support to the patient and the patient family to the with the prayers. Okay. Then urine, how to we can collect the urine sample. So always you can keep the your urine and the in anus area to clean it, and clean it. We can take the further small first we can leave the small amount of urine in the outside. The midstream of the urine we should take and we can collect it and we can keep that urine sample. Then in the stool we can always pass the stool with the kind of spoon will be there. You can take it and keep it and you can close it. With this sterile method we should follow, because you should not touch to the inside of the container. Okay, you should always outside you can touch it. Then what are the needs? We have that investigation related. So mainly we have that blood pressure check for hypertension, means it's a silent killer symptoms will be there. So we always check the if you have, maybe it will cause for heart attack or anything, it will be there. So always you can keep the BP checkup. Then blood test means overall it's a cholesterol or triglyceride. So this is and all leads to heart attack. So maybe you can follow that improve diet and lifestyle medication. So that is and all you can use it. Then colorectal cancer. The colorectal cancer mainly we can use for the cancer polyps. That abdominal growth it will be there. The age 50. So we have that frequently polyps find means we can family history we can take, and rectal examination you can do it, and then we can find the mass to the anal cannula. Then digital rectal examination, so lower part rectum we can find it. So you can highly treatable for the these cases. So you have any progress and all you can take for advanced method. Then vaccination, so vaccination is the 10 years. At the age 65 is the pneumococcal vaccine provided to the pneumonia patients. Then eye exam, so it's annual screening we can do it. So increase the chances of glaucoma and cataract and all. So we can do the eye exams. Then periodontal exam, so it's a oral health, it's mainly important to the age many older adult. In the medication can give the negative effect of dental health. So antihistamines are diuretics and antidepressants. So that is and all we can do it. Then hearing test, so hearing test is a natural part of the aging. It can be infection to that other medical condition. So every 2 to 3 years we can use that audiogram, the audiogram checking process. Then we can clear that loss of loss of say, hear capacity. We can treat it. Then we can control that seriousness of the hearing loss. Then bone density scan. So we have that International Osteoporosis Foundation we can give. So 70 million people are affected to the osteoporosis, the both women and men also. So mainly we can give the calcium supplements or anything we can give. So we can doing for yearly one checkup and all we can provide. Then vitamin D test. So vitamin helps to protect your bones. It will be heart disease or diabetics or some cancer and all it will be produced. So we can give that always vitamin D supplements and all this one. Then we can go for the thyroid stimulating hormone screening. So this is we can give for the regular body metabolism we can do it. Then we have any sufficient hormone balance and all we can maintain. Then if you have any weight gain or something and all we should weight gain, or you have anemic and all we can treat it. Then we have that any dysfunction or TCH hormone dysfunction means we should always check the blood test and we can find out it. Then go for the skin test. So skin test, maybe we have any new suspicious mole or anything is there, you should go for the full test, full body test. Then blood sugar test, blood sugars we can go for the once age start for 45, it's important to the check for the HbA1c. Then mammograph, it's a cancer society says it's a woman between the 45 to 50. They have clinical breast exam. It will be there. So we can find out to this 2 years once we can do it that mammography. We can find it the cancer or anything we can find it. Then pap smear. So 65-year regular pelvic exam. It's a main important. So it can detect any vaginal cancer or cervical cancer and all we can find out. Then prostate cancer screening. So the prostate cancer can be detected to either digital rectal exam. It's specific to the antigen levels of the body. So it's maybe we have to detect post cancer for Indian males. Then we can go for that blood pressure, eye exam, bone city. So all the tests we can do it. Then handling and dispensing medicines. So this is all more than 45 to 65 ages. We should all maintain that educations. Sorry, educations, and we can do for the all the investigations. Then we can go for the handling and dispensing of medicines. So mainly we have that major medication for older adults means ignoring to the medication uses. Then medication forgetfulness will be there. Then physical mental status will be elderly. They need others help to support for medications. So we can relative negligence will be there. Economic and environmental problems and all will be there. So how we can do it? First we can have that side effects affecting of thinking and balancing. So we can give any medicine. We can always we can educate to the educate to the gain to the knowledge about that medicines. So if you have any anticholinergic anything they're taking, sedatives and all taking means we should know the side effect of the medicines. Then symptoms of means treatment. So always we can have any certain burn, heartburn, incontinence, depression and all, which that means we should always taking the medication is important. Then drug interaction. So some drug and all we have that that warfarin and all we have that blood thinner will be there. So we should always educate to appropriate medicine for the adult person with related after disease condition. Then only that reduce the risk of the problem also. We can have that prothrombin test and all we should do it for before only. Then side effect may be strong effect to the older person because they have that every weakness will be there. So blood pressure and everything we should take according to that level. So if you have any adness or any sugar drop and everything will be there means we should always we check that blood pressure or all vitals we can give the medications. Then bedridden of scheduling and taking medication. The maybe the oldest they have severe pills and all take for the different times. So minimum they can follow that daytime or nighttime. So according to that depend they can take. If you have any medicine miscause, it's a serious effect for the older persons. Then cost of medication. So cost of medication we have that medication cost is high. It will be burden to the holder because the financial resources it's facing the problem. Then we can have skip and to take under we should not advise. Then we have alters any other medication we can, especially in the low budget, we can write and we can give to tell them to take. Okay. Then we can have the role of geriatric care assistant for the giving medicine and adult. So mainly the old adults we have that liver and kidney maybe work, it may not work. So we have a function under we should take because in the medicine it will be work to observe to the all the body. Then the medicine stay for the body longer and severe side effect will be there. So the dosage will be adjusted to the older person. So age related we can change that weight loss or any fluid intake and fatty tissue and all will be there. So particular we can give that changes to the medicines. Then increase sensitivity towards of the medicine is the most common for the older adults. Then we can give for the impaired memories and hearing and vision loss can be difficult to understand medicine instructions. So we should always face to declining high sight is important, grip strength is important, mobility and memory lapse and all. We should it will be affect to the safe medications prescription. Then we have that inadequate communication also it will be loss. Then we can have any prescription for different health professional also they can't able to track and identify the medicines. So it will be ineffective medicine for the irrational and poly pharmacy is the most important. Then background literacy is the main for the elder patients. So it's a disadvantage. They can understanding the healthcare provide work also. Then chronic condition diabetes or high blood pressure or arthritis and all we should always management is the important to the take care of the geriatric person. Then we have that any medication plan if you are forgetful means we should always working and we can ask the cost. We can give that plans according to the medications. Then how to manage the medication for the old adult. So make comprehensive of the list of medication. So being prescription, you can over the counter and all we should avoid. Then we can go for that check the whether the drug it seems severe purpose or any managing of pain or anything means you should do it. Then we can have type of counseling and effective content reducing depression anxiety and we can do it. Then check drug to drug interaction also, it's important. Do not stop medication until doctor informed, it will be dangerous. Then we can go for that any several times we are taking and all means you should avoid it. Always can be stop non-drug treat if you are tiring means. So that is and all we can do it. So mainly we have that what are the principles we have, that it's a important questions of the medication administrations. So take and explain what you are going to do before giving the medication to help the individual involve the possible in the process and provide privacy of the patient. Give the administration to complete attention. Then give the medication if the criteria if from the free from the distractions. Never leave the medication for unattachment. We should not give. Always wash hands must before giving the medication. Then we can have that rights of the patient also important. So we have mainly rights of the patient. Giving medication is the main question for the 2 months or 5 months they can ask. So we have checked the first the right patient, right medication, right dose, right route, right time, and right documentation, and right reason, right response. It should be there. So we this is this all the question is the important. So I will share the questions also. You can prepare it. Okay. So if you have any doubt also, you can ask it.